This presentation will cover complementary therapies and integrated care. So we know the connection between mind and body is well recognized, and that conventional medicine that's practiced in the United States is based on scientific methodology, and this is known as allopathic medicine. The practices that differ from and are used instead of the usual traditional practices, these are known as alternative medicine. Practices that differ from but are used in addition or in conjunction with traditional or conventional medical treatment are known as complementary medicine. Complementary medicine is viewed as holistic, meaning the whole person is treated. Most complementary therapies are not really founded on scientific principle, but they have been shown to be effective in the treatment of certain disorders. So, herbal medicine. The Food and Drug Administration classifies herbal remedies as dietary supplements or food additives. Their labels cannot indicate any type of medicinal uses, and they're not subject to FDA approval. So they're not well researched, and there is limited quality control. A lot of folks feel that herbal medicine means that it's natural, but natural does not equal completely safe. Certain plants from which even prescription drugs are derived can be highly toxic in their natural state. An example is foxglove that's used for digitalis, and then there's another plant, deadly nightshade. Because of the lack of regulation, standardization, the ingredients may be very adulterated or changed. The method of manufacture may alter potency, so there's just no quality control. It is safer to use preparations that contain just a single herb rather than combining them. So moving on to acupressure and acupuncture, I think this is very beneficial for folks, especially for pain. It dates back in Chinese medicine to 3000 BC. The main concept is that healing energy flows through the body along specific pathways called meridians. These meridians connect at a series of acupoints, and in acupressure therapy, the clinician applies pressure to these specific acupoints. The pressure to the acupoints is thought to dissolve any obstructions in the flow of healing energy, and this helps to restore the body to a healthier functioning. So in acupuncture, they use these little tiny sterile disposable stainless needles and put them into the acupoints to kind of dissolve those obstructions along the meridians. And these are the different tracks or the different meridians. And they target those depending on what type of problem you're having. And we use acupuncture to treat pain, respiratory problems, pregnancy nausea, depression, anxiety, headaches. So it has a lot of different types of uses. So here's a comparison of traditional Chinese medicine with Western medicine. And a lot of folks, again, believe in combining the two of these, or of course using one or the other. Moving on through to diet and nutrition, we hear of all different kinds of diets, and most of them do work. A few years ago, Weight Watchers was voted as the most successful program for people, and it was found that Weight Watchers was so successful because people had a group. They were able to meet regularly, hold each other accountable. There was camaraderie and kind of a universal belief that they were all in this together. So people tended to lose weight when they had that support system. I think that keto diet is extremely effective. This is the very high fat diet. It causes folks to achieve some pretty rapid weight loss, but it's tough to sustain if you don't stay on it for the long term. So I'm sure you all have heard of a lot more diets than these, but this is just some examples. So chiropractic medicine, I'm sure a lot of you all might participate and go to chiropractors, and it is a widely used, developed in the late 1800s, and it's all about how the energy flows from the brain to all parts of the body through the spinal cord and the spinal nerves. And if you replace, or if there's any displaced vertebra in the spinal cabinet, in the spinal column, then this is pressing on your nerves, and it can interfere with nerve transmission. So any displacements of the vertebra are called subluxations, and to restore function, they manipulate those subluxations and utilize other techniques like hot and cold massage, ultrasonographic types of treatments. Chiropractors are licensed to practice in all 50 states. Therapeutic touch, another technique. This is relatively new, and this is based on the philosophy that all human bodies that we have our own energy fields, and that we can use our energy fields to unblock pain and illness in other people. So this was something that we were using a good bit in the 70s and 80s, but I don't see it used or practiced very often. So practitioners do not actually touch the client's skin, but they use their hands and use slow rhythmic motions, and they sweep over the body and about 2 to 4 inches from the skin, and kind of push away any of the negative energy in order to reduce pain, anxiety, promote relaxation, and health maintenance. So massage, you're actually touching your patients, and that's manipulation of muscles and soft tissues. And of course, massages tend to feel very good. The Eastern style focuses really on balancing the body's energy as it flows through those meridians. But Western style of massage, we work on muscles and connective tissues, kind of that physical therapy type of approach. It is contraindicated in patients with high blood pressure, infections, any osteoporosis, phlebitis, skin conditions. So it's not for everybody. Moving on to yoga. Yoga is old, 5,000 years old. And the goal of yoga is to integrate the physical, mental, and spiritual energies. So this is a very, very popular. It helps to enhance health and well-being. It's helpful for relieving stress, improving overall physical and psychological wellness. Uses not just physical movements, but breathing, meditation, and mindfulness. I think all of us can appreciate pet therapy. There's a lot of pet therapy utilized in mental health. When I was working on the acute care unit, pets were brought into the clinical setting often. I mean, sometimes every day, and it was wonderful. The patients just loved it. And pet therapy is utilized throughout acute care settings, also in outpatient settings. You'll see maybe pets brought into shelters to help persons who've been victims of trauma. And we know from research that pet therapy can help reduce the death rate from recurrence of heart attack, lower blood pressure, enhance mood, decrease depression. Dogs, a lot of dogs are used now to assist those veterans who've had PTSD. And animals might actually retard aging process among those people who live alone. It's actually one of my favorite prescriptions to write is for a pet therapy But a lot of our older patients are very apprehensive about adopting pets because they're worried that if something happens to them, who's going to take care of their pets? So that can certainly be a problem. Integrated care is kind of the second part of this presentation. Your book looks at integrated care as combining complementary therapies, but we're in today's terms, with the Affordable Care Act, integrated care means something different. It's all about combining services under one umbrella. So, and those services include lots of different disciplines. And the reason these disciplines are being combined is that it's an attempt to create a more efficient healthcare delivery system. And that, of course, reduces cost, improves patient care, and everybody wins. So it's a coordinated system where medical and mental health providers work together, they collaborate, the charts are combined, social work is involved, maybe dentists, GYN services, and these are some of the key elements that are required in order to qualify as an actual integrated healthcare setting or program. You have to have comprehensive screening and assessment. That means all of your patients need to be screened for not only their healthcare conditions like diabetes, blood pressure, but they also need to have screening for depression and anxiety, mood disorders. And this is important because we know that any mental health condition certainly impacts your health conditions. So you need to identify and treat all of a person's conditions, and hopefully not in separate places. So shared decision making and patient-centered care are essential components of integrated healthcare delivery systems. And that means your patients are partners in their care and they are engaged. And it's a very important role for nurses to make sure that our patients are well informed of treatment options, informed of the risk and benefits of treatments and alternative treatments, and really help them to set realistic, measurable goals in their care. So medication algorithms, protocols, standardized assessments, again, all of these are aimed at producing a more efficient healthcare delivery system. And one of the central parts of an integrated healthcare system is an efficient record system. And this is where the electronic medical record comes into play. And this makes all of that information, the patient's records, available to everyone, and that helps to reduce redundancy, so people aren't going out and getting additional lab work done or imaging studies. And again, this helps to improve patient care because nobody wants to go out and get repeat blood tests if it's not necessary, and it just makes for a very efficient delivery of healthcare. So these are the rationales. I think it's pretty straightforward. It helps to decrease the cost, helps to decrease fragmentation, it helps to improve access to services. We're treating the whole person, and we're treating them, probably more effective. We know that primary care providers actually care for 80% of persons with psychiatric disorders, and in fact, they've become that de facto mental health care system. So it's important for primary care providers who are providing mental health services to have those resources available to them, psychiatric mental health care resources available so that they can provide the most appropriate care for their patients with mental health problems. So these are just some more rationales that justify integrated health care. We know certainly that people with chronic illness often have comorbid depression, and that symptoms are often easier to recognize if you're doing the screening and if the care is being provided in a collaborative way so that everybody knows what's going on, and we don't have little bits of information about patients scattered throughout a variety of practices. So here's the research to support evidence on integrated health care. And the integrated healthcare model is basically drawing from Wagner's chronic care model. So this was the theory and the research from this model that kind of served as the building blocks for integrated care. Here's information about the elements of collaborative care. We talked about screening, information exchange, the delivery of care, multiple service providers under one roof. The mental health and behavioral services can be either co-located, but the connection can be in one building. But again, the connection is what's important. Hopefully they would be under the same roof. And there's another model here, collaborative care, consultation, and liaison. But the goal ultimately is to integrate the care. Here's a patient-centered medical home. This is terminology you'll see used to describe those places that have a whole host of services. And those services will include like GYN, dental services, psychiatric, primary care, maybe peds. So it's, again, a very holistic model of healthcare delivery. There are some barriers to providing this type of care. Some healthcare providers might feel that they've lost autonomy. I'm not just sure why that would be such a problem. It's nice to have the input of other people. Primary care providers maybe have some limited training in mental health treatments, and workforce shortages, limited time in primary care clinics, lack of agreements, lack of reimbursement for screening. Maybe there's some issues with same-day billing restrictions. And so there's a lot that needs to be worked out to decrease some of these barriers. But again, it's all about creating a more efficient healthcare delivery system.